pledge.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks, Chris.
Must have missed your for a second.
Okay, thank you all for coming. And, start off with our motion for acceptance of minutes.
Second.
Any discussion, changes? All those in favor?
Aye.
Any opposed? Thank you. HS1 is a resolution authorizing a budget nod for the Department of Social Services to accept state aid for the homeless services plan, $45,000. Lisa, do you want to say anything on that?
It's some admin money because the lift has been heavier and heavier with what the state is asking for out of us, so it is $45,000.
Is that something that's going to most counties or?
Yeah, every county's getting it.
Look for a motion.
I'll move it.
Any discussion? All those in favor? Vote.
How's that, so we're getting 45,000, how is that covering extra work that was, lift is getting heavier? How much of a help?
So it's not any direct service, this is all admin. There's this thing called the Homeless Management Information System, that's federal data. And we're part of a 3-county continuum of care, it's called, from HUD. And so we bring a lot of money, like probably 650,000 federal money into Oswego County by dealing with all of the paperwork and data systems, HMIS, you have to pay licenses, you have to pay for all of that. Then the state now is asking us to analyze that data and put it into a local homeless plan, and they approve these plans. And there's like 3 other plans that have to do with
This one will
homeless.
go a long way to get that done. You know,
Well, yes,
okay, good, that's fine. I'm not asking for specific.
as my eyes glaze over with all the bureaucracy they're throwing at
That's
us.
fine, you answered my questions.
Okay.
Other questions? All those in favor?
Aye.
Any opposed? Passes. Okay, next is our resolution authorizing the budget modification. Social Services to accept state and federal aid for the Central Services IT staff. It's about the New York State mandated cooperative contract agreement that New York State has recently approved, even though you sent it to them in January. If you want to elaborate, this is benefits the county in the end, even though it doesn't maybe look great on either one of your budgets.
So this is where, you may recall during 2020 budget, or 2019 proposed budget talks, all of our IT was centralized under our county IT folk. So we took the 2 full-time people we had at PSS are now umbrella under Greg's team. And they did, Doug and Essie came in with a whole different cost allocation plan that removed all of the folks who work or touch DSS IT services and came up with a cooperative agreement. So it's a contract that the state had to approve. They recently approved it, and what it allows us to do now is claim a monthly amount for central services. So if Veronica was here, she could speak to it with much more detail, but basically it is going to maximize state and federal funding to support IT in our county.
So I'll look for a motion.
Motion.
Okay. Any other questions? It's really just a shift, essentially, of monies from one to the other, but maximizes reimbursements. Right, any other questions? All those in favor?
Aye.
Any opposed? Thank you. HS3, this is budget mod, Department of Social Services to accept state aid for raise the age placements, $350,000.
So we're putting expenses and revenue, this is 100% approved, or 100% state funding as long as we stay under our fixed cap. It was very difficult to get our arms around what the state was asking us to do with claiming. And once we got clarification on this, we're creating these lines to claim for kids who are going into care through raising age.
I'll look for a motion to discuss. Second. Questions? Is this gonna be adequate?
I think this will get us through this year, but as of October of this year, 17-year-olds are added into that mix, so we may see some increased costs. Keep in mind, DSS is not placing these kids. These kids are coming through the county and into family court instead of criminal court now, going into placement instead of jails now. And so we get it typically after the kids have placed.
And is this a reimbursement of costs, or is this based on an estimated amount? Is it specific?
No, it's a reimbursement of actual costs. There is secure detention, that's separate from residential placement of our TAUs. That's where we kind of got confused, that there's two different pieces to that. And the secure detention, we're not getting billed for, and we don't have any costs or reimbursements to secure detention. Is there, Phil, am I kind of getting that okay?
Any other questions? All those in favor?
Aye.
Any opposed? Any motion carried? Next is the HS4 resolution authorizing the budget modification, social services to accept TANF SYEP, that stands for,
Summer Youth Employment
oh
Program.
yeah, right, exactly. Fund, so that's $28,972 for the summer youth employment program.
All federal funds are local share.
Look for a motion to discuss.
I'll move it.
Any second? Any questions on that, folks? All right, all those in favor?
Aye.
Any opposed? Nobody wants to go home?
Stacy, that one wasn't signed by you, so when it comes around, can we make sure to sign it?
Yes.
Thank you.
HS5, this is the resolution authorizing acceptance of $1,000 from Pathfinder Bank that they're donating for the Veteran Services Agency dinner. Jamie, what about that?
So they're not donating the $1,000 for the dinner. They're donating $1,000 to the agency to keep the Veteran of the Year program running. So the dinner is actually being funded by Exelon's EMAC team. So that's already, the check has already been delivered through the United Way. They assisted the agency facilitating for that. So the check that was sent to United Way on behalf of the dinner was for $1,600. So the dinner has already been covered this year, but because we didn't have any money in the budget allocated for this, since it's the first year we've done the program,
Pathfinder donated $1,000 to the agency so we could keep this program going.
For a motion to discuss.
Make this motion.
Second. Questions for Jamie?
So this is basically to help fund next year's.
Correct. And there's actually no stipulations for use of the $1,000. It was donated on behalf of the Veteran of the Year. The story is that they came up with something to do for the agency, to give back to the agency. So there are no stipulations on use of the money. I intend to leave it there so we can.
So what you'll need to do at the end of the year is ask Treasurer's Office to roll this revenue next year.
Okay.
That way it'll be there available for you to use.
Perfect.
Otherwise it's fun.
Okay, so we have first and second on that, correct? Any other questions for Jamie? And so, great cause, should be a good dinner. All those in favor?
Aye.
Any opposed? Good. Alright. Got reporting from departments, office of aging.
Well, we're still working on our 4-year needs assessment. We've put it on our Facebook page. It will be going out this week to the senior building as well as senior clubs to get good feedback on that. I do have it's just 2 pages. If anybody would like to share that with any of your constituents, really it's gathering information to see if the programs that we have are meeting the needs. If they're not meeting the needs, if there's any suggestions what they think is lacking, and suggestions on what they feel is needed in our community. We take that information then and make sure that we're spending our office for the aging dollars that we receive from the state and federal government, as well as the legislature. Make sure that they're being spent the way that people feel that they need to be spent, or if there are gaps that we can shift money around to try to cover them. So every 4 years, this is a requirement by the state. And we take that data as well, because this is a big 4-year plan that we will be submitting to the state where we see us heading as a county and the services that we need, how we're going to meet those needs. So if anybody, like I said, I have them here. So anybody wants to take any with them to share?
I'll take some.
Okay. There's also a survey monkey, so anybody wants to feel savvy or feel comfortable going online, certainly can go online to complete the survey as well.
Could you send that link to us via email?
To kind of tie into that, we also applied for the age-friendly planning grant. It's through the State Office for the Aging. It's an $80,000 grant. The first step of that was to become a member of AARP's network of age-friendly communities. I did have to, thank you, Chris, we got a letter from the chairman, sure that he had support the application for that. It's a 2-year grant. Basically what it is a planning grant to show that we're an age-friendly community. As part of the grant, it's we would hire a person to manage it, to go and do the community assessments, to hold public meetings, gather information on how we are as a community as age-friendly, to see where we need to be better, and then ultimately it is creating resolutions and policies within the county stating that we're going to be age-friendly. This is an initiative from the governor's office. New York State is the first state that's an age-friendly community. Now this is a push to bring it down to the local level to have counties as age-friendly counties. And it's really hitting the 8 domains of livability and the resources that are within your community. So it's planning when you're building in urban areas that for seniors or for them to age, that there is shopping, that there is transportation, that the streets are accessible or sidewalks, there's accessibility, that there's availability for social participation, that there's social inclusion, and that their health services are easily reachable. So it's a big planning grant to see where we all get together in that. The end of October, we'll see if we were awarded that or not. We're in the same group with Onondaga County, and I do understand that they were applying as well. So my fingers are crossed that the underdog will come through and get funding for this. But I'll keep you all posted and let you know how that goes. Are there any questions on that?
Question.
Yes.
Sure.
How about the agent that's out in, let's say, the Boylston area, or Redfield, Williams down there, where there really is nothing there, for them to be able to, they'd have to get a ride to come into somewhere.
As part of it, because there are the public meetings, we would take that feedback and try to see how we could include that in. There's not funding for transportation. This is planning to make sure that when new structures are put in place, that is taken into consideration for this age-friendly planning. So it's basically as part of the planning of new structures and new housing to make sure that it's taken into consideration that it's an age-friendly community.
Thank you.
Any other questions?
Sarah, could you just send this to us electronically as well?
The link,
Yeah,
the
no, not the
Survey
link.
Monkey or the letter as well?
Yeah, both of
Okay.
these, if that's all right. Thanks.
Anybody else?
Moving right along then, the State Office for the Aging was on site middle of August, doing our annual evaluation of the programs and how we spend the money and go out in the community and how we're utilizing those dollars and funds for services. All positive feedback while they were on site. It's gonna be probably another 6 weeks before we get a letter from them if there were any corrective action measures. At that time, I'll share that information with you. But it was all very complimentary on the staff and the programs that we have and how we address issues. So I don't foresee any issues or corrective actions. If they are, that would be minor. Where it has been in the past is our case management, as we have to go out every 2 months and they say, okay, 2 months, is it 60 days, is it 2 months? And sometimes we do have issues trying to get those assessments done within the time frame, so it might be 61 days instead of 60 days. We do address that as we move along, but that would be the only thing, and it's a minor issue. We continue to work on the county website. Office for the Aging is going to be one of our office, not the county website, but our portion of the county website. Our office will be one of the test sites for the web sales. So we've been working with the treasurer's office to get that set up. We're hoping with the ability to take money off from our web page, that's going to help with our contributions, because our contributions have been a little sluggish the last couple of years, at least in the meals program. So we're hoping family members that might be outside of town that want to make sure mom and dad are getting that meal, maybe they'll go onto the website and be able to contribute that way. So we're happy to be part of that testing of that for the rest of the county departments. All of our farmer market coupon booklets have been distributed. It's been about a couple weeks now. It's 840 booklets, $16,800 potentially in their food purchasing power for our seniors. And I did receive notification last week that Senator Ritchie's health fair, where it has been in the 3 counties that she represents previous years. This year it is just going to be in Jefferson County at JCC. It's October 11th. I did reach out to her contact person to express my concern that this is a very well received event in Oswego County. Transportation will be an issue, as well as St. Lawrence County, where both similar in size geographically. It's also a very big county, so for the seniors of Oswego or St. Lawrence County to have to travel into Jefferson County, into Watertown, I think it's a hardship. I asked if they had any funding for transportation. I got a phone call this morning and they said they're looking to see what they can do, but there's nothing right now. So that might be something that you hear. I don't know how well publicized it's going to be that it's not here, that it is just up there. You might hear some of that feedback. If we had known as the Office for the Aging that it would not be in our county, we probably would have reached out to partners to see if there's something that we could do here ourselves, because it is so well received. We are looking to work with our partners next year to see if there is something that we can do together. It's maybe in the month of May to have a senior health fair at that time here in the county.
But, yeah.
If you were to, like, arrange transportation, how many people would you be willing to transport off? Like 50 or 100?
I don't know. I mean, if you were to do transportation, we don't have it to do in our budget, but I guess I don't know what the capacity of buses. We would, if we were to do it, we would look at OCO to see the capacity of their buses, and we probably would do maybe 3 or 4 buses from different areas of the county. That's how I would envision it, and it would be what their cost would be. I don't know if they do an hourly cost plus a mileage or how they do it. That's not something that we looked into, though. I reached out to Senator Ritchie's office to see if they had looked into it at all. And at this point, they had not. They were exploring to see if they can get sponsorship for that. But what I was told is their funding was dramatically cut, and they still wanted the health fair, and they had to choose, so they chose Jefferson County because it's in the center.
Go ahead.
That was my last item on there, other than we have been receiving HEAP applications in our office, so we are calling for the early outreach. HEAP is not open yet. Doesn't open until the middle of November, but seniors who received their applications approved last year and received the benefit, they have received their renewal applications. So we are receiving them in the office. They started coming in on the 26th, August 26th. So we're processing those now, as well as gearing up for open enrollment with Medicare Part D. That opens October 15th, but the plan starts sending the literature out. As soon as the literature goes out, we do get calls and people wanting to come into the office. So other than that, that's what we have going on at the Office for the Aging.
Thank you. Any questions? Okay, Ryan?
All right, so the first thing on the agenda is the youth court month, which is in September. So the youth court members will be coming to the legislature as well as the council for the city to be recognized for the work they do. Aside from hearing court cases, they very much volunteer within the communities and are involved with different tasks along the way. When we did the anti-bullying piece earlier this year at City, they were majority of the young people who are involved were coming from that program. There'll also be some guest speakers and different things happening for the youth court month. The Paul Santor Award, I just thought it was important just to bring out to you guys that aside from what the award means, the recipient this year is actually a 20-year-old who has gone through a lot of our programs and was recently just hired to be a police officer in the city of Oswego. So part of his plan is to continue to work with young kids and give back to the community, but he is a young person who's been involved in a lot of our programs growing up through the years. So that will also happen at the meeting. School starts tomorrow, so we shift gears from summer quickly to go right into our programming that we work with. And a couple things to note with that our Youth Advisory Council and our Leadership of Oswego County Youth Groups are both made up of high school age students. And both of them work on projects throughout the year, so it's always keep in mind if you want something done, because most of the school districts are covered. My friend Jerry over here sends lots of kids to the programs, and I always say to the other districts that complain, Fulton figured it out a long time ago, that if there's, 7 spots they can send somebody to, and somebody else doesn't want to send, then shame on you, that they can send them for that. So both of those programs are operating, so it's a good opportunity, if you're looking to have a study done or get some information out there, that these kids can run and do that along the way. Sarah talked about a little bit as well with the webpage update, that for us, a really big piece for the parks part is moving along with working with Dave and to get it up and running, that we're trying to make it as user friendly as possible, so that you can go on there and you can do everything from signing your child up for Camp Hollis to booking a facility to going along with it. So there's a lot of moving pieces that we're doing, but I think in the end, what the potential is for that is going to be very big, because of the fact of right now with the current page, you really can't do anything on there. So this, I think, will be really beneficial, and so it seems like on a daily basis we're in communication with Dave and Brian to look at different things we can do to work in. It's kind of unique in different parts, so we kind of have our own little page working out there right now. We'll also go into our RFP process that is in the press release today, so that's where you trail funding for youth development funding. A lot of agencies that receive that funding, working with youth development. Our board of directors will review the applications and make funding decisions on what they feel is most appropriate. So that will be heading out there if anybody has any ideas of any programs that they want to work with. We have one new program that we recently just started, and Legislator Krasik is on the committee with me. It's called T1D Oswego County. I'll pass these around. And very alarming that we're recognizing that the numbers of type 1 diabetes in Oswego County is rising. And it's going to affect that when a lot of times when a child is diagnosed, they don't know where to turn. And then there's a lot of information that's not out there for what they can do and they can't do. So we have a new group that we put together. There's going to be some focus groups happening at City, where we're going to have panels of youth who are type 1 diabetics already, all the way up to adults who can talk about when they're young, or parents, or whomever. We have a great group that we've just put together. I don't know if you want to add to that.
Well, I want to give an example. 2 weeks ago, I was at the Sandy Creek with the school for a child that has T1D, and they did not get it at all. And we were there for 3 hours educating them that you don't have a choice. This is what's got to be done. This is what's going to happen. And we finally did get them to come around and come up with a program so that this child can start school and not be singled out, but at the same time pay attention to what the needs are, because we don't have a nurse that can constantly monitor it. There's other things that can help take care of it. But it is an education process. People don't know. So they're going to be presenting at the health committee next month, and I haven't told Chris yet, but we're going to try to get a recognition proclamation for what the group is doing. They've got a Facebook page. They're really very strong in creating this link so that when parents get that diagnosis, they can go on this, and they've got a lot of people that can communicate that are living in the same environment with their children. So.
He's right that you have to be prepared, because we've had kids who've attended Camp Hollis with type 1 diabetes, and it's you have to be prepared for it.
Be ready.
And it's a piece that you go through. I had 2 kids who were type 1 diabetics, so it's something you learn, and he's right. You don't have a choice. You have to move forward with it. So we are prepared, with camp and such, but I think others need to, schools and such have to be on that same page, so that, and then the families knowing what they can do. So it's been a great group that we put together, and it's a great team.
Sorry about that, Chris. I was going to wait till we got to the committee meeting before I put that in.
That was on his agenda.
That's on my to-do list.
So along with that, when we talk about that, I have these, and of course probably enough of these, but the Hollis Harvest is going to happen at Camp Hollis next month on October 19th. Good or bad, like I always say, good or bad, that we average about 1,000 to 1,200 people that will show up to camp that day. So that's why I say good or bad. Do I want 1,000 people there? No. But that's who shows up. Even on rainy days, we get a real amount of people. So I'll be reaching out to the sheriff again to see if they can provide a deputy or so if parking becomes an issue. But it's a great opportunity again if you're trying to get information out there that what we do is they have a they can trick or treat at the cabins and such to that, but we try to encourage the groups to make it healthy friendly, not to necessarily think about candy, think about whatever it might be. It's pretty much sold out on the groups who are using the cabins that they sign up. We didn't do it last year because we were under construction. So again, this year it's sold out quickly, but everybody, different groups will be there. The health department is there. It's really fun. I can't give you the list because Jennifer could, but giving you that if you're interested, we will find room for you to fill in. Well, example, the health department has a smoothie bike, so the kids have to ride the bike and make their smoothie, and it's a healthy related snack they'll get, but they actually have to make it. They have to pedal the bike and make the blender go to have it happen. So there's some neat stuff that happen at that. So it's a Halloween activity to be safe. Quickly, just a couple other things I'll touch base on. I mentioned to you before, but we did get our AmeriCorps grant for the next 3 years going forward, and that will be starting November 1st. There are 74 open spots, so sites will be looking to, if they're looking for members, to be applying for that. At Camp Hollis, we had a good year this past year. The official number is 501 kids attending Camp Hollis, which is 76 more than last year. Things went very well. It was pretty quiet this year for the most part, and it went good for the plans that Zach has moving forward. He's been pretty aggressive when you guys do see my goals. He's been aggressive with his numbers for next year. He's pretty confident the year under his belt that he can reach those goals. The day camp through as well. Update your Gaga pit has been painted. So that is still being used and working well. Phil could probably tell you a little bit more about it, but the Ready group for Lake Ontario Camp House is on the recommended list, which means that there was a recommended list and a waiting list or consideration list.
Right, it's up there, so.
Right, so that's looking to work with the bluff erosion piece that we've had that we submitted a, the camp house having, this being a problem, working with Dave Turner, we had some information that we at least gave for backup. It's really what's there, it's a shovel-ready project if necessary that looking to do. So that's a good thing to go forward. We still are pretty full for rentals through the rest of the year. That house will be used up till November 1st, which goes off of that you've heard me say before with that with the grant we submitted this summer to try to winterize Camp House. That would be to continue because people will constantly want to continue to use the facility, but it's just you can't do it after November. I was at Camp Zerby today. The construction phase is winding down. It's supposed to be done by now, but it is not. But they look like they were wrapping up a lot of the work that they're doing. But that is with that septic and well through the grant we received through Senator Ritchie. Our leadership of Slow County Youth class had their orientation. They had 18 kids do their overnight orientation, and they'll be moving forward throughout the school year. Again, these are all things that will happen. The community services directory will be being updated. I know that we've gotten a few emails recently from people requesting to update their information. That will all be going out. It is online. That's all we do now. We don't do printed copies. So that can be updated at any point in time, but this is when we will reach out for anybody looking to do any updates, anything you want added to it. Again, because it's electronic, it's not very difficult to do. So if there's a section you want changed or updated, it can be done. Our community services forum will be happening in November. Working with my friend Mr. Stu back there, that there will be 4 this year. Is that what we're saying? That you're going to do 4 different opportunities for the community to reach out and learn about different community service programs. The benefit of the one we do is we always like to tell people to bring a a teammate with you when you come to the event, because yes, it's a tabling event, but it's a great opportunity to network, so that you hear names, you have new staff to have them go around to meet the other people who are there. So that will be in November. A date needs to be picked, but it will be in the city of Oswego this year. Last year we were in Fulton, and this year we'll be in Oswego. Working with the city of Oswego School District on their new code of conduct. We've been working with that along the way to test that out on some kids with getting opinions on different pieces. Things like youth court have been able to contribute information to that. And then our summer programs that are all round up, I'll have final numbers for you by the next meeting, because there's no coming in from municipalities reporting back on different things, so I don't have final numbers yet. So that's really about it right now.
Questions for Brian?
What's the process if somebody wants to join youth sport?
They apply. There's an application that.
Right, is there a training they gotta go
Yes,
through?
they gotta go through a 20-hour training. The next training potentially could be over winter break. It's gotta be, usually when we have, because of just new trainings, that we like to have about 15 to 20 kids to run the training for the event. So the next proposed one would either be during Christmas break or spring through winter break. But any applications that come in, they'll keep them up to date to when the training is due for the next training. So if you go on our webpage, the ad is there, I believe, that I can get one.
With the minimum age 12, 13?
Middle school. Gotta be in middle school, up until, and we have some kids who are their freshman year in college and will come back and still their cases at their home, because they still need to do service hours and they're committed. So, but middle school age is what we're looking at.
Do you have numbers on the number of cases or kids that have been through?
It's picked up for some reason in the summer, which is odd, because summer is usually the slower time when schools are closed. I don't have your exact numbers right now, but I know last month there was about 7 cases last month.
So does that mean referrals are just working out better too?
Well, the referral process, everything's going through probation right now. So
All-
probation, everything goes through probation, but schools can still directly refer. So that's why I said that it's interesting that things picked up in the summer with schools being closed, as we would think, but summer schools not closed. You're still staying current.
Any other questions? Stacy, Department of Social Services update.
Yeah, so I provided you a written report. I think the only thing I've heard you to comment on is the request for proposals that went out. And yes, we did see with the first 3 we've gotten back a $249,550 increase. That is, we did put some additional funding in our 2020 proposed budget. However, we also have, I think, 3 more RFPs out there. So this is kind of catching up since we hadn't been putting RFPs out on many of these contracts in child welfare for a very long time. So, the rest is, I think, self-explanatory. And after Veteran Services updates, Jerry Getner and a couple of our CPAC members are here. And my job is really easy today, because they'll take it. Any questions?
No. So you're gonna go back and try to get us a little bit of a justification on some of these increases, some of them which are pretty steep percentage-wise.
Correct. One of Carrie's staff will be doing analysis, looking at what was covered under 2019 budget, what's being projected to be covered under 2020 budget, and the differences, if there's any, in deliverables, how many families served, the activities. So this is all, fairly recent. We received these proposals, and all of these don't start until January 1. So we've got a little bit of time. I can always go back and negotiate if we're not feeling comfortable with what they're asking for. I just wanted to give you folks a heads up.
Well, and
They're all kind of coming back. Those 3 were single vendors. There was nobody else that.
on those 3, well, anytime there's a choice, I think we would like to try to see the paperwork that comes back, or the decision process matrix, whatever.
Yes, it's when it was umbrellaed under Oswego County, we had a rating and scoring. There was actually numbers put to things. Onondaga County does not do that, and I don't remember why. Do you? It has something to do with, I think, county liability, or there's a reason. Yeah, there's a reason they don't score them though. So it's a very simple form. It's really just pros and cons. Here's the people who put in a proposal, and here's the pros and cons.
I think it had to do with subjectivity of different people scoring things, and they score them differently, so if they ever had a challenge, would it stand up?
Right.
That's what. Yeah, but lots of people still score, it's just their preference.
Okay, questions for Stacy? Let's move on to our report from veterans.
Good afternoon, everybody. So Veterans has really been focusing on our Veteran of the Year dinner that we have coming up on the 18th of the month. We've also seen a big increase in activity. So out of the 420 hours our office put in last month, 171 of that was spent editing records. We had 317 phone calls that last on an average of 10 to 18 minutes per phone call. We've seen a huge increase in non-service connected pensions, which are for surviving spouses or veterans that are going through the Medicaid process. So we've been working with DSS to really hammer out the Medicaid referral process so we can get those completed in a quicker fashion. Something I'm going to start doing next month is providing a gross dollar amount data of what's coming into the county. So we had one veteran who got a retro payment of $94,800. And we worked really hard on her case. We went through 2 different appeals in the last year with her, and she was awarded $94,000. So in terms, some other counties are counting what compensation is received by veterans as revenue into the county, not into their budget, but saying this is what our agency is bringing in to the county. I think that's important for everybody to see as well. So starting next month, I'll attach a full report on how many contacts and cases we've come through, how many DSS referrals we've initiated, so there's some tangible activity there that you can look at. As far as everything else, we are down to 7 pending records. So I don't know if you remember when I started last year that it was an astronomical backlog. We're down to 7. So our office in the course of a year has really just hammered out a workflow where we do intake on day 1, 2 days to do the paperwork, 3rd day the claim goes out. So they were taking almost 21 days to process claims. And that was from the date of the appointment to the date that the application got out of the office. So now it's down to 3 days. So big kudos to my office, and I know I never really present, evidence for that, but I'm going to start doing that. So that's all that I have for my office right now. There's nothing.
Okay, thank you. I'd like to welcome the folks from the Child Protection Advisory Council. And if you wouldn't mind maybe introducing yourselves. I know a lot of you know everybody, but make it make sense to say, go.
Starting?
Yeah, start over there.
I'm Carrie Lamb. I'm with the Child Advocacy Center.
I'm Diane Godfrey. I'm with the Department of Social Services.
I'm Dennis Mulaney, emergency physician.
I'm Jerry Diner, Director of Student Support Services for the Fulton School District.
Director of Services at School.
I'm Stu Amell. I work on special projects for city.
So you have a presentation for us. You want to share the copies as well?
Yes. I brought enough for legislators, not enough for everyone.
Okay, Jerry, you have the floor.
Thank you very much. First of all, I want to thank the committee for having us back annually to provide our updates from the Child Protection Advisory Council. And just to take us back to the charge that you presented us with when you formed this council was for us to lead a coordinated effort to improve the prevention, identification, and response to child abuse and neglect in our county, ultimately making Oswego County a safer place where children can thrive. And the objectives that we've set, or the vehicles that we've set for ourselves as a committee to achieve that mission, was to work on establishing collaborative community partnerships, facilitating programs that are collaborative in nature and build on our strengths and assets within our community, strengthening the prevention efforts that already exist, and seeking out additional prevention efforts that are evidence-based, recommending policy and procedural changes that will make the system more efficient and responsive to the needs of our community, and building community awareness and understanding that child welfare is really everyone's responsibility within a community. And as you know, you appoint the members of our committee. I currently am serving as the chair of the committee along with Mary Margaret Pico of Catholic Charities as the vice chair, walking in the footsteps of several distinguished chairs before me, including Harry. You can see that our membership represents a diverse group of providers across all systems in the county. From my own perspective as a school employee, I'm pleased to see that we have 4 school districts and city BOCES represented with frontline staff who work day to day with children, families, and directly with the caseworkers from DSS. So our overall umbrella goal is really to support an effective child welfare system. And the importance of collaborating across disciplines and across agencies and organizations to create a system that is coherent and cohesive, and once again responsive to the changing needs of our community. We want to send our appreciation to the Board of Legislators, this committee in particular, Chairman Rehill, for your commitment and interest in the work that we are doing. We appreciate your presence at our meetings. We also appreciate that you have provided additional resources for training and supervision. Community Development Coordinator Diane, adding a great deal of value to the process and the collaboration. And also just keeping up to date on the significant changes that impact this system. We appreciate your efforts in that regard. So as I tell my staff, as a social worker by training, in human services, sometimes we like to operate by intuition and irritation. Either we sense something is wrong, or it bothers us so much that we feel compelled to do something, but we can't operate without the data to back up that intuition. So the next several slides that we share with you will cover the data from the last year or so. So the first one you can see.
Oops. And how do I do that?
Yeah,
You can see how high tech's in.
There we go.
There it is.
So begin by just an overview of the number of recorded incidents of child maltreatment. So you can see over the past 5 years, there's been an increase of 37.25% of reports of child maltreatment in Oswego County. And as we analyze the data at our meetings and have conversations among our team, we recognize that alcohol and drug addiction has had significant impact on those cases and reports. Another important bit of information for you as evidence in the data is the recurrence, the number of incidents that are recurrent. In other words, that reports to the central registry that have additional reports within 1 year of the original report. So if you look at the comparison data between the national recurrence statistics, the state recurrence statistics, and Oswego County, you can see that we far exceed both national and state level percentages.
Jerry,
Yes.
And just, would you rather wait the question for the end, or is it off there?
I think I might know, there's some other slides that speak to reoccurrence, so maybe at the end.
Okay. Okay.
So one of the areas that we've looked at about why this recurrence is happening is really that the caseload of our DSS caseworkers is well above the recommended 15 cases per caseworker, and we feel that overdue reports and inability to follow through in a timely manner because of the number of cases each caseworker is contending with is contributing to this. In addition to that, we have concerns about some of the high-intensity services that these families may need, such as mental health support. Those are impacted by the availability of those services within the community. Family services caseworkers, also those caseloads have risen by almost 34% in the last 4 years. And preventive services, for those of you who are not aware, come into play when the health and safety of the child is at high risk, and without preventive services, that child would be at risk of out-of-home placement. This slide details for you the number of children who are placed under Article 10. Relative placements have increased 46.8% over the last 4 years. You can see we started out with 50, and as of now have 94 children in relative care placements. This slide depicts the monthly average of children in foster care, and a significant increase, 56.2% over the last 4 years. And we recognize that about a third of these placements have involved alcohol and drug addiction, other contributing factors being parents who have significant developmental delays, mental illness, and many of the residual effects of poverty. This slide outlines the increase in petitions to court. 511 petitions were filed in 2018, and most of those petitions involve several appearances on the part of caseworkers and DSS staff in court. Just to summarize the staffing, Carrie Benzing is the Director of Services, oversees 84.5 full-time equivalent caseworker positions at DSS. 38.5 of those are assigned to child protective investigations, and out of that, 38.5 are on the NDT that investigates the most serious cases of abuse and child fatalities. And you can see the breakdown: 28 assigned to family services, 7 to youth and PINS, diversion, 11 to adult protective, 2 senior caseworkers who work at family court, 16 supervisors for the caseworkers at a ratio of 1 to 5, which is the recommendation, and 6 managers overseeing policy practice. One of the challenges that we've spoken to you in past years, and one that continues to be one we want to bring to the forefront, is the dilemma of the turnover of caseworkers that impacts the work that DSS is able to do. And you can see that 50%, you can see the turnover rates there in 2015 at that high of 36.6%, but it's hovered right around the 30% mark in the subsequent years. And 50% of the caseworkers resigning have more than 3 years of experience. So when you take that into consideration and look at the replacement and the turnover and the impact on the availability of trained and well-prepared caseworkers to be in the field, this is a significant barrier to the success of these programs and services. So as a CPAC committee, we have supported some of the efforts that you have then endorsed, including the establishment of the Northwoods program system to streamline the record keeping and use of the iPads in the field, including supporting specialized training with a trauma-informed focus, having the therapists who can help respond to the needs of the caseworkers who are facing these very difficult situations and dealing with the residual trauma of those situations, internal training for new hires, and also having the DSS attorneys available to provide support to the caseworkers who are witnesses in court and presenting their findings in family court. The next slides show you the percentage of caseworkers with more than 15 investigations of child maltreatment. And you compare these with statewide, we have 2 to 3 times the number of caseworkers assigned more than 15 investigations, which is the recommended threshold. When we look at timely safety assessments, our CPS team is working diligently. They're doing a really good job of completing their assessments and their documentation in a timely manner. But you can see that this is still an area that we would like to see more improvement. And finally, this slide will show you, to conclude the data presentation, the percentage of overdue investigations. Again, we've made progress in this area at DSS, but the percentage of overdue investigations is still double that of the statewide data. And timely documentation does impact this performance measure. So getting things done in time and manner. So with that data in mind, we wanted to really move into making some recommendations and summarizing the findings. And I can tell you that today was the first day for me as a school official back with teachers. And we began our opening day in Fulton by lining up one student representing each of the graduating classes to come, starting with the class of 2032, our incoming kindergartners, all the way up to the class of 2020, which will graduate in June. And one of the things that is striking to me and to the staff that I work most directly with in the student support services realm in my district is the ever-intensifying needs of the students who are coming into our schools on a daily basis. And this plays out in a lot of the work that we're doing as Child Protective Advisory Council and the work that you are doing on this committee. We know that the needs are greater than they have been, and we know that our resources are just as limited as they have been in the past, and finding more effective ways to meet those needs continues to be our challenge. So one of the things that we have looked at, and I want to thank Stu for his leadership in this area too, because he works with a steering committee of superintendents who helps foster positive interactions between DSS and the 9 school districts in Oswego County and State. The quality assurance process where follow-up calls are being made to check on the outcomes and the level of collaboration and satisfaction between school personnel and DSS staff has made a tremendous difference in how we work together as a community. And it's important for us to continue to find ways, more effective ways to work together. One of the other areas that we wanted to bring to your attention is that, as I have mentioned previously, best practice is not to have more than 15 central registry reports open as an investigator at any one time. It takes about 6 months to train a caseworker prior to sending them into the field. So if you look at this, having 40 and a half casework staff positions, fully staffed caseworkers would be assigned caseloads that would be below that recommended threshold. But as a result of turnover, that is not currently happening. Training requirements, medical leave, caseworkers being pulled from rotation because of their high caseloads is further impacting the ability to keep that ratio at a manageable level. This has had a direct impact on the safety of children in Oswego County because the reality is 20 or fewer caseworkers are in the rotation at any given time, able to accept an investigation and follow through on those safety assessments. In addition to that, the results of the DSS may be unable to close a case in a timely manner, and children are not seen for required contact. So this slide really outlines for you the number of incidents where those safety assessments and required contacts are not made. So if you look at the last bullet, 450 active CPS reports with 18 caseworkers represents over 2,300 child contacts that were missed as a result of caseload demands. They were missed. They were not made at the time. In addition to that, you can see that the retention rate in family services is higher, which is a good thing. But the children on these caseloads are at high risk of abuse and neglect. And family services workers therefore are required to make additional visits and assessments. Once again, this is an area where we see the impact opioid and synthetic drug crisis, a significant increase in foster placements, and at the end of July of 2019, a little over 1,800 contacts were missed and approximately 250 cases were being family services. So our recommendation as a committee is that you consider providing an additional 5 hours of funding and allow caseworkers who volunteer to work a 40-hour work week to be afforded that option. Provide for 8 new caseworker positions with 2 new senior caseworker positions to provide supervision. As you can see, the data that we presented demonstrates the turnover rate. About a third of caseworker positions are vacated every year, and with the increase in caseloads that warrant the staffing increase, DSS must provide a supervision ratio of 1 to 5 supervisor to caseworker. The new positions would help us build capacity to compensate for that turnover rate, the delay that occurs when we do hire new caseworkers who have to go through a training process and aren't ready to hit the ground running right away. And this will allow more CPS workers to be in the rotation. In addition to that, another efficiency that we would like to suggest consideration of is invest in client transportation services. Caseworkers are spending time transporting clients, children, and families to court-ordered services. When you look at the number of hours that it's spent doing so, it equates to more than 1 full-time position per month, where caseworkers who are trained and ready to hit the ground running, helping support safety, are then instead spending time transporting families to court-mandated services. We feel this would be a much better utilization of our skilled staff. Our last recommendation is that you consider investing in preventive services. The Families First Preventive Services Act, as you know, the federal legislation is changing the way, will change the way that local districts deliver child welfare services, and that we're seeking to reduce that recurrence percentage. We don't want that high percentage of recurrence, the central registry reports, as a measure of our county. And in order to do that, really investing in those community-based services, being more preventive rather than responsive in our approach, and keeping in that vein, CPAC convened child welfare providers, many of them in Oswego County in July, to really analyze what our greatest needs are and what are the gaps that currently exist in services, as well as what is out there that we might not be tapping into as a community. Our goal is to reduce the removal of children from their homes by making sure that the interventions that we are providing are actually effective and working, and that we're using best practice evidence-based interventions in what we do. With that, I'm going to invite Dr. Mullaney, who is a member of CPAC, a physician, emergency room physician, to provide just a summary of his insight and experience as it pertains to child welfare.
I'd like to again thank you for your interest and support. It's really important, the work we do. It speaks well of the county. I'd also like to remind people I feel who've been here 10 years, it is much better than 10 years ago. Children are much safer. As a kind of a local physician, I work around the state. Children in Oswego County are much better off, for sure, than like Essex, Franklin, Clinton, Montgomery, Bolton, other places I work. So we have made progress. The kind of negative or dark side of this whole presentation is the increase in caseload, which, as Jared mentioned, drugs, alcohol, homelessness, mental health. And I don't see, every year it gets worse and worse, and it's very refractory, especially the drug problem to treatment. I just see the demand getting higher and higher, which I think is a lot of the reason we have the turnover. This is a dangerous job, demanding, and we need to do everything we can to increase retention, because it's like the practice of medicine. I don't want to go from emergency room work where all the nurses are new grads in July. I want to go someplace where there's nurses been there for 20 or 30 years. It's totally analogous to the practice of delivering care, protecting these children. The turnover just, we need to figure out a way to reduce that. And I appreciate all the support we've had so far. Okay. On the positive, I just want to mention something we haven't mentioned. I think it's important to mention is what we're all talking about so far. What we talk about is, we're reacting to a huge problem. We just don't seem to be able to stem the flow. But there is a new program through United Way, Patrick, it's what is it, Imagination Library, where the children come in and the parents, when they bring the children to the provider, they're given a book. The parents are taught that reach age appropriate, how to interact with the child, how to deal with the child with the book, and they every visit. And this is the kind of, and it's not costing the county anything. There's a number of programs like this, but this is the kind of thing that 5 years after 5 years down the road, you will see increased readiness when the children enter kindergarten. Better, a little better in school, less poverty, and so that there are positive things happening. I would encourage you all to support this program. It's not costing us a thing. It's $2 grand. And again, thank you for allowing me to serve on this. As I told you before, it probably benefits me more than anyone else. It's very therapeutic.
So that does conclude our formal presentation. We're happy to take questions. But again, I want to reiterate our thanks to the committee for the ongoing support of CPAC and your willingness to listen to the work that we have done throughout the year and the recommendations that we bring to your table today, recognizing that you have many conflicting priorities to balance in your lives.
I'll start off then. I think first, like this format presentation was excellent. I greatly appreciate the mix of empirical data, statistics, and then at the end your recommendations, which are well written and seem to be pretty precise. So the first one I'll leave with is just don't worry about giving me an empirical answer on all of these either. I think your anecdotal response because we don't need to wait in philosophy probably on this. But on page 5, your annual number of reports of child activity. The one question I have there is on an earlier slide you mentioned that there were reports of possible child abuse. My question is this, approximately what kind of, is it a lot, a few, rarely, where you get a report, but it turns out to be basically a false report? That someone's saying this happened and it's not, true. Would that be occasionally, rarely, once in a while? What were your thoughts on that?
I'm gonna
That would be me.
over here.
So
I hear you give the wave earlier,
about 65% of reports end up being unfounded. Doesn't necessarily mean they're false. It just might mean that we don't have enough evidence to say that there's no abuse or treatment.
Wow, so that's pretty significant, especially when on this paper said there's a 37.5% increase in reports, but 65%. Obviously you got to look into everything that's even mentioned. So that's a little bit of, I don't want to say good news, but cushions it a little bit. So good, thank you.
Can I just,
that number.
yeah, if I can do a little bit of a follow-up. What Carrie said though was, unfounding doesn't mean it wasn't true. And in fact, because we close some of these as unfounded, because we don't have quite enough from a doctor with a failure to thrive kid, what's really happening with that kid? Why is that 18-month-old failing to thrive? We can't found it for a variety of reasons. I think that's one of the issues about our reoccurrence rates being higher. They keep coming back to us, Brad.
Yeah.
They
and then
And they get worse? Do they get worse when they come back?
yeah.
can.
Okay, good, thank you, that does. We all want to do the best thing for these kids, and it's gotta be a horrible feeling when you get a report that you don't have that, really the kind of thing that it's.
Just had a judge talk to me about it last week.
The next one I have is on page 8, the turnover of caseworkers. In this anecdotally, we had a magic wand, what would be maybe the 2 top reasons that they leave?
Well, actually, I believe Stacy and Carrie had that information from exit interviews.
Carolyn, no, thanks.
I could come up here and say,
Sure.
Uh, so currently, basically stress, trauma, balance between work, life and home life
So
and
that's not an
salary.
easy fix. Salary. That's kind of what I figured. We talked about it before. Good, thank you. Then on page 9, under the turnovers, one of the bullets says internal training program for new hires. We send people to the state for training, right? How much time are we spending internally in that, and kind of what's the mix there? Just give me a little bit of a feel without.
So the state program is 6 to 8 weeks.
Yep.
Our internal program is 6 months. Because our caseworkers are going to the state training and they're coming back unprepared to take reports or to work on their caseloads. So we have a much more robust training to take care of that.
And that training then though isn't like 40 hours a week, it's probably a few hours a week. Then are they already on?
No, so CPS caseworkers cannot assume a caseload until they complete their state training.
Yeah.
Family services caseworkers can start with 2 or 3 cases, but again, because we are immediately doing safety and risk assessments, they are not allowed to do that on their own until they've completed their state training.
Right,
And
I still the state training. Then after the state training is complete, now they come back to, our principal officers who are back on our county PSS.
Yep.
Then they immediately go to our internal training.
It coincides.
Oh,
They go through it together. I mean, ideally, we can get them into the state training and then they get through, and then there's just a couple months left of internal training, and then they go into rotation, where they start accepting, a full family services caseload. But during that time in the internal training, they are going out in the field on a regular basis, and there's already,
They're contributing.
they're contributing. There's assessments being done. Absolutely.
Is the state training pretty good?
No, it's not.
We don't need to go into details there.
But the facility is gorgeous.
Carrie, part of what our internal training process does as well is help to interpret what some of the regs are that they learned while they were away at training, to how we do it in this county and who our go-tos and all that.
And the last one I have is on page 12. The 450 active CPS reports, 18 caseworkers, 2,300 that we say how many missed, 2,361 child contacts were missed. Is there any legal liability? Obviously, we don't want that to happen. It's for the benefit of these kids, et cetera. Are we under a legal liability there? Are we in danger of anything?
Maybe Phil can take that one.
Well, can you, Tom,
No,
but it's on an unrelated question that, when you say that they're missed, so what does that
I
mean?
can explain. So in May, I review all the stats that you have received. And I was seeing an increased number in overdue reports, late safety assessments, etc. So I asked my senior caseworkers to meet with their caseworkers in May. Find out if they made the contacts with children in May. If they didn't, if they did, we set those reports aside. If they didn't, we then counted how many contacts they missed. Actually, that number's higher. Because the reports, when they made the contact in May, we didn't then go back and check those. We just counted that as sufficient, because what we had to do, we had so many reports, I had to call the state and say, we're not gonna meet your mandates. I've gotta get these caseworkers in, we've gotta close these reports up, because right now in this pending status, nobody's making their contacts, and we have to start fresh and start new. So that's what we've done the last 3 months. We went from 751 overdue reports to less than 80. But what we had to do is a supervisor was basically sequestered in a room with a caseworker. We wrote one long summary note just saying, hey, we made these contacts, this is our determination. If any of those cases are reviewed or audited, we'll get red marks. We will not pass our audit. As far as liability, I can speak to other counties. I used to work for OCFS, and what I talk to my supervisors about, my caseworkers about, is we're never immune from liability. Caseworkers have had criminal charges on brutality cases. In Boone County, the sheriff's department walked in and handcuffed the caseworker and took them out because there was a child brutality and the caseworker's notes weren't in. That was a DA's decision to do that, but we're always open to civil suits.
My
Especially
question
when that
is
happens.
that, are we missing
Right.
something and also by liability with mandates and potential funding, et cetera, not just in cold-blooded here that it's that, but are we gonna miss some, state requirement, it's requirement to make these contacts when we're not doing that. So, and that was my last question, so I'll just, again, repeat that this particular format, when you presented this and everything in here, it's greatly appreciated. This is good for us, for me.
Great.
Yeah, thank you for that.
Legislator Brown.
Thank you, Mr. Chairman. Page 10, and this is the first time that, since I've sat on this committee, that I've had a historical perspective, right? So I came on in 2016. It's the first time that I've sat down and looked at the numbers since I've been elected. And I don't know if it's for the benefit of the committee or maybe just to help wrap my head around it, but the numbers there's some numbers that jump off the page to me, and maybe somebody can provide some context on kind of where we're at. I think I know some of the answers, but I'd like the context behind it. If we're looking at percentages of timely safety assessments, in January of 2016, we sat at 72. In January of 2019, that number dropped to 29. December of 2018, we're at 27. Can someone provide some context on why those numbers are so drastically different?
So those numbers are so drastically different because of the turnover rate and the amount of inexperienced caseworkers who are in our fold and are having difficulty multitasking and getting their safety assessments done. They become extremely overwhelmed with crisis cases. So for example, they might have plans to do 3 or 4 safety assessments that are due this week, but then they have to do a removal. And their removal takes all of their time, and they don't get back to it. That's usually the reason.
How elaborate are the actual safety assessments?
So for a 7-day safety assessment, you have to contact every child in the household. You have to contact the subject of the report who's alleged to have committed the child abuse and maltreatment, and you have to make a home visit. That's what you need to do for a complete safety assessment in the field. Then you come into the office and you have to document 18 different safety factors and whether they exist in the household or not. We used to do best practice where we would put notes in prior to the safety assessments so that our supervisors could review those notes and make sure our caseworkers were making accurate safety assessments. The reason why the numbers have gone up this year is we took that requirement away so that they could just complete the safety assessment without the notes. And now, since we've got our caseloads down, we're starting to bring in that requirement that they put their notes in.
And so, am I understanding this right, that timely safety assessments directly impact the percentage of obviously overdue investigations, correct?
Absolutely.
Yeah, to the
Because
same.
you can actually, the majority of your investigation is done in the first 7 days of a report, and if caseworkers simply had the time to get back in, maybe do one follow-up contact to get their notes done in time, those cases would be closed rather quickly.
Right. Yeah, and the reason I bring this up, and we've talked about the job of the caseworker, and I'd like to think I understand that, right? I haven't been in their shoes, obviously, but I think I can wrap my head around, the stress and what they have to go through day in and day out. What begins to get under my skin a little bit, and I'm as guilty as everybody else, is we've talked turnover since I've been in this room back in 2016. Turnover. What are we going to do about turnover? And it's a little bit of frustration, but at the same time, it's also a gut check and to look in the mirror and say, are the practices that we're implementing are they sticking? Right? right? So this committee, this county legislature put a good amount of money into Northwood software, right? Because we wanted to be a tool for our caseworkers to be able to be more flexible when they're out on the road. I think the transportation idea that's recommended, I think that's a great recommendation. You know, we shouldn't be, unfortunately, we're not a taxi service, but caseworkers a lot of times are in those shoes, so I think that's a good recommendation. But you know, for me, it's a gut check because we've been talking about turnover since I've been here for 4 years now. And to see the numbers where they are scares me. You know, it's not necessarily moving in the right direction that I think any of us want to see. And that's as much on this legislative committee as it is as we are collective groups. So I just think as we move into budget season and things like this, it's just I'm sure I share everybody's feelings. It's just frustrating to try to make strategic investments. I know they're going to take a while to turn all the way around and see the results of that. But to see us talking about turnover and these things back in 2016, to see these timely safety assessments in January 2016 get 72%, and we're down to 29 and 27 in 2018 and 2019. It makes me question our trajectory. And that's as much on us as everybody else. So it's nobody's fault. The problem's evolving. There's so many factors that might not have been there in 2016 that there are now. I understand that. But at the same time, it continues to overwhelm me a little bit.
I might comment on that Northwoods has actually helped us keep some people in place. You'll note that we've shaved about 10 points off of that turnover, even though it's still pretty exhaustive, even though we've shaved that much off. And if you look at those increases, we've increased anywhere from 30 to 50% of every single program with the same amount of staff, and yet our turnover has stabilized. So I think it's important for us to get kind of up in the airplane and look at the picture as a whole versus kind of getting into the fray or just kind of picking one data set. I still believe we're making good gains and progress, but there's no doubt about that I have more sleepless nights this last year than I had in 2016. This is terrifying stuff.
And it's a dynamic process. If I get an acute stroke in, a STEMI in, then the person with belly pain is not going to get seen for 2 to 3 hours, even though they're level 2 or 3 triage. Okay, it's if they could, if it's a certain number of suspected abuse or neglect cases came in every day, split out evenly over 24 hours, you wouldn't have to treat it. But there's going to be times when you have to treat it. And like I said, if you got something where there's imminent danger and you've got to do a removal, that's very intense. I mean, I don't know if anybody's ever been involved in removal. I mean, I recently removed a child because that's a different story. It's quite intense, okay? The parent of this child had to be tased 6 times. I went out and told him, no, I'm taking, your child in protective custody and made to the hospital. It's a very intense deal, and that night, same deal. That took up a couple hours of my time, and so this is a dynamic process.
And it's a two-way street, right, Doctor? I mean, at the same time, this CPAC was born out of a partnership, right? So it's as much as it is on the legislature when we receive recommendations on ways to improve retention of caseworkers. It's a two-way street. This is how this committee is supposed to work. So that's as much on us as going to a 40-hour week or hiring on caseworkers or looking into a transportation initiative. That's as much on us as solving the problem as the day in and day out. So please don't think I'm in no way pointing a finger, because we've heard the good stories with the caseworkers, we've heard horror stories with caseworkers.
No, I just want to make a point that when you can't control the case, by the nature of the beast.
Right, each of us uses our own frame of reference. So my frame of reference, of course, would be school. And I have 3 teachers at each grade level in most of my schools currently. But one teacher at each grade level was not available for 6 months because they were being trained. And those kids all had to be pushed into those other two classrooms. Learning wouldn't happen at the same rate or level of excellence as we would expect. And I'm not sure that parents or my other teachers would be comforted by the fact that in 6 months those teachers would be done with training and be available to relieve that. When it's safety, it becomes an even more pressing issue, and I appreciate your acknowledgement that this is a continuing conversation.
Yeah, it's tough because from our shoes, we look to control what we can control. The state mandated training is something that's obviously everybody's hands, right? But, it's just, trying to make strategic investments with things like Northwoods to be able to give some flexibility to our caseworkers. And, you see numbers like this, I know it's not going to be overnight, but it just makes you think.
If I could just say thank you too for what you just laid out there. But there's a couple of thoughts. And I think it was Mr. Trudell that actually came out a few years ago and did a ride around with one of my caseworkers. And so we would always welcome that because you can't possibly imagine what a caseworker experiences without experiencing it with the caseworker, correct? And the other thing is I would offer too is most caseworkers that come in have not been exposed to any of this in the past. So that's pretty overwhelming and it is very traumatic. Even those of us who are seasoned and have been out and seen a lot, it's still, when we do a removal, that is awful. That is never a comfortable or a normal thing for us to do. So when we have new caseworkers that are fresh in rotation, they're experiencing that, and then we're wondering why the turnover. It's like, how do they process that? When they've got their own young babies at home, So those are some things that just, I would ask you to kind of keep those things in mind too. But again, thank you so much for all the support we get from this committee.
I would definitely recommend this.
Just to sort of wrap up here, I think, in 2015, we started the anti-poverty task force. And, this, although there are many facets to that, this is one of the key pieces that, we knew if we can solve some of those other problems, this is going to help to solve some of these problems. And I think we've implemented a great number of things working so close. Stu started that with me back in 2015, and he's been instrumental in helping to change the relationship between the schools and the Department of Social Services. So like the doctor said, we have moved things in the right direction. We implemented these things from last year that we ticked off on page 9, Jerry, the Northwoods, the therapist, and internal. We've done the things that we, other than simply throwing money at it, which now it looks like we're at that point where now we're going to have to be the advocates to throw money at this again, or more money at it in the fall. So our understanding of these problems, and as hard as we've worked and all of the great things that we've done, all the things that have happened in the schools, we're still fighting an uphill battle. I think DSS is doing, I think, a tremendous job with what they have. Now we have to try to keep those people. So, are we going to, try to increase? Now we're talking about 8 more caseworkers. That means additional supervisors as well, or at least 1, right? 1 for every 5, or so. This is not only new positions, but talking about trying to put the pay on par with probation officers or people working and doing the same types of jobs in Onondaga County. We're the advocates for that. If we think that that's what we have to do, we're the ones that are going to have that. And we know that's going to be a difficult sell, but we need this kind of information and these kind of presentations to be able to do that. So I think, it's not for lack of trying and trying a bunch of new things. It's also the uphill battle against the mess that's occurring in society with those drugs and what's happening to families. So I think we just continue to laugh.
Just a quick question, Carrie. Page 10, the recurrence of maltreatment report. I'm assuming those percentages are on the full spectrum of all reports, the total amount. In other words, would it be possible to calculate the recurrence of reports among that roughly 65% unfounded.
That I would have to check because we get these figures from the state, then I could see if they can create a report for us like that.
The reason I ask is I've heard for years 65, 70% unfounded. And I know sometimes it's because you can't find the evidence. But I'm uncomfortable putting that out there or with the idea of well, it's unfounded, but they're probably guilty anyway. I don't think that's a culture that our investigators should have. If we could determine the recurrence among the unfounded, or better yet, the eventual indication among that 65 unfounded, that would give us an idea of what percentage of the overall reports really are false alarms, and our staff time is being wasted.
I thought reoccurrence though was only for indicated reports. Is that?
Yeah.
The reoccurrence, I believe, is for if the report was indicated and then they get another report indicated within the next
So
12 months.
that's not gonna help us pare down the
But
65%.
yeah, I'm not sure. I mean, occasionally they can get into those systems and create an ask for the system. I can always check.
I mean, we should all be concerned. Generally, all the issues identified here are about high caseloads, people being overwhelmed, more intense caseloads, more complicated caseloads, and it's creating these problems. But if we ignore a large percentage of the reports that were false alarms or an abuse of the reporting system, which happens a lot in courses, and how do we address that too, to reduce the number of false reporting that's coming in? It is a crime to do that. But I've never seen any, I don't know what efforts are being made to address that portion of these reports, which if we could do that, would help our overall, would help the entire picture. I know without discouraging real.
Do you think the district attorney would report? In my experience, these occur on Sunday night. The reason I like work Sunday night, it's when parents exchange children.
Well,
They bring in little Johnny or little Jane. Oh, look,
Yeah.
Daddy or mommy or girlfriend or boyfriend, and they want to report.
But those are very easy to discern. And I
Yeah.
can tell you from the Child Advocacy Center, our statistics are very much in parallel with the Department of Social Services because we're only seeing the abuse cases that come through. And I can tell you of the 468 children who came through, only 29 actually had arrests. 29 of those cases actually went to arrest. But we still provide services, so you still have a system in place that can provide services if you talk about prevention or RVIP program or different things that you're out there connecting with your service providers. So I think that it's important to get at your question, but I think it's just as important to provide a service for if we can't have the proof that we need to either indicate or arrest.
And I will take that back to one of the recommendations about the forum that was held in July to really assess the preventive response of the community. And even when those reports are unfounded, and I'll think of the ones that I have made myself as a community reporter in school, and a number of them have come back unfounded. And the reason is because when the safety assessment is done, it doesn't meet the threshold. But from the perspective of our community standard, that's a family that's not functioning at a healthy level necessarily. The children might be safe, but the needs of the family are such that preventive services would be very beneficial to prevent that recurrence call. And so I think that the focus on, one of the ways to get at what you're saying is if we can be creative and collaborative around the prevention side of this, so that when those unfounded reports are established, that family just doesn't go without some kind of support services to remedy whatever the reason for the call was in the first place, or to address the goal that they might have around that reason for the call.
I'm not arguing
Yeah.
that.
No,
I'm
I know.
arguing about the unfounded ones
Sure.
that should not have been there in the first place. There's nothing.
Right.
That circumstance is pretty rare though. We do report to the sheriff's department when we feel we have a false report and a name's locked because they can leave reports anonymously. But the majority, I support Jerry's comments, the majority of cases, the reason why our foster care numbers are so high is because those reports that were unfounded, those families really, they have risk. They need services. We just don't have the capacity to provide it. So then, they bumble along until something unfortunately serious happens, and then we take them to court, and that's when they get the mandated services.
And the psychology of the abuse and this transgenerational domestic violence and the nature of these cases is difficult because we're also dealing with recantations and things that people realize, I might not be able to live at home, or my kid might be taken away from me, and so there's the encouragement of the take back phase. And so then there's not much that then caseworkers or law enforcement can do.
If the child's removed, they lose the check. I mean, I've heard people say that. I mean, their plan is to have 3, because that's New York State, that's the maximum you get, and they'll never have to work. I've heard that from parents.
All right, well, thank you for all of you and your work on the council and for your recommendations, and we'll obviously take them under consideration as we move forward. Is any other questions for anybody? I would look for the appropriate motion. Second, anybody? All those in favor?